Oh, hey, it's Matt. This is part one of a four-part series of how I found out the healthcare system does not care about my health. We start 5 years ago, after I'd been selling health insurance for 5 years, and something that came up over and over again in all my meetings when I'm helping people with their health insurance is that they had a doctor they loved, somebody who knew their prescriptions, who knew their history, and they would rave about this doctor. And I'm sitting there at 34, I care about my health, I'm still young, but I'm getting older, and I think, why don't I have a doctor like that? Going forward in life, I want to make sure I'm healthy. I should start a relationship with a doctor now who's my age, and as I get older, he'll get older, and he'll just know everything about me, all of my health issues, and all of the things that I want to accomplish out of life with my health. I thought it was perfect. I get on Google, I find a doctor who's similarly aged to me, I set up a physical, I pay cash for it because I just had catastrophic health insurance at the time, and I walk in all ready to go and start this relationship. The doctor immediately wants to get down to business. He apparently doesn't have too much time for me, and judging by the relative health of all the people in the waiting room, I could understand why. I start feeling bad that I'm not sick. I start trying to come up with some sort of malady so this guy can just write me a prescription or write me a blood test or give me a referral and get me the hell out of there. I start really feeling like this is not a place for healthy people, and I feel like I'm healthy, so maybe I'm doing the wrong thing right now. So I end up telling this guy, I don't know, I got an international flight coming up in a couple months, and I get a little nervous from that. He writes me a prescription for Xanax, kicks me out the door, and I say, well, I wanted to start this relationship. When should I see you next? He goes, if you're still the same health over the next 5 years, not for another 5 years. So what I learned was that this guy couldn't write me prescriptions. This guy couldn't send me for lab work, blood work, imaging. This guy couldn't send me out for a referral, and he couldn't get a regular customer. The current healthcare system only profits and can only make money when you're sick and when they can prescribe you things, when they can run tests, when they can do referrals. That's the only way they can make money. And so I was a shit customer for this guy. He didn't want me. He didn't want to create that relationship. So I found out the hard way. They do not care about my health in the standard traditional healthcare system. Make sure to check out part 2 for when I think I find the right solution for me, and it ends up being not the right solution yet again because this situation didn't care about my health either.